So why is pelvic floor health important for people with hypermobility, POTS, and dysautonomia? Number one is support and stability. So your pelvic floor helps support your pelvic organs, which for people with connective tissue disorders can be a risk factor for tissue laxity. So even more important to address pelvic floor function and pelvic floor coordination and strength, as well as learning how to coordinate and manage increased pressure in the abdomen. For stability, your pelvic floor is an integral part of your core. So it's really important for stabilizing you in your back, your hips, and your pelvis, which can be super important for function, especially for people that experience pain in the back, pain in the hips, and any pelvic pain. Another really important reason pelvic floor health is important for hypermobility, POTS, or dysautonomia is tension. So if you think about all the muscles in our body, they are working to stabilize our body. If you have hypermobility, this can lead to more muscle tension because the pelvic floor and the other muscles in your body have to contract and kind of squeeze to support your body through tension, because sometimes they may not have the stability they need to support you through stability and strength. This tension can lead to dysfunction in the pelvic floor, which can lead to symptoms affecting bowel, bladder health, including difficulty with urination or difficulty with bowel elimination, constipation, as well as any symptoms of leakage, fecal or urinary leakage, which is actually really common. So in a study of 12,000 community dwelling women from ages 25 to 84, they found that 37% of them actually had some kind of pelvic floor dysfunction. So it is much more common than most people think. Another really important function of the pelvic floor is circulation. So your pelvic floor is really important for helping circulate blood and lymphatic flow in the pelvis. It's kind of like the calf. The calves help return blood back to the heart, and the pelvic floor and the diaphragm also help pump blood and lymphatic flow as well. Also, your pelvic floor is important for autonomic function. So it's really tied to our stress and our fight or flight or freeze. So addressing your pelvic floor can sometimes be really helpful for stress relief as well as autonomic function.